We've all heard of fibromyalgia before, but many people are not aware of all the possible causes and treatments that can help you with it. Fibromyalgia is a condition that affects millions of Americans. It's often misunderstood and has an unknown cause. But it's clear that fibromyalgia is real and can be treated. It's also clear that there are misconceptions about the condition. So, in this video, we'll try to demystify the subject and help you know what you're dealing with if you're suffering from fibromyalgia or have a loved one who does. What is fibromyalgia? Fibromyalgia is a chronic condition that causes widespread pain and fatigue. The pain and fatigue can be so severe that it interferes with a person's ability to work, sleep, and participate in everyday activities. Fibromyalgia is a relatively common condition, affecting up to 5% of the population. The cause of fibromyalgia is unknown, but there are several possible contributing factors, including genetics, stress, and infection. Fibromyalgia is a type of rheumatic disease. Rheumatic disease is one that affects the joints and muscles. It is also a disorder of the body's immune system. This means that there is an overactive immune response, which leads to inflammation. This inflammation in turn leads to tenderness and pain. The pain can be widespread or in a specific area of the body. It can affect the muscles, tendons, ligaments, bones, and other parts of the body. It can be accompanied by fatigue, weakness, and stiffness. There are several possible contributing factors to the development of fibromyalgia. These include genetics, stress, and infection. However, these are only a few of the possible contributing factors. Fibromyalgia is more common in women than in men. This is probably due to the fact that women are more likely to have stress during the menstrual cycle. Women who suffer from this condition are usually over 30 years old. What are the signs and symptoms of fibromyalgia? The main symptom of fibromyalgia is chronic muscle pain, which is usually located in the back, neck, shoulders, arms, hands, legs, hips, or abdomen. People who suffer from this disorder may have other symptoms as well, such as headaches, difficulty sleeping, tenderness or swelling of certain areas of the body, and numbness. It is possible that there is a genetic component to the condition. It is also possible that the condition is linked to some kind of infection. One theory is that fibromyalgia is a form of myofascial pain syndrome. This condition is caused by irritation or injury to soft tissue, rather than the skeletal structure. Another theory is that the condition is a reaction to emotional stress. Here are some signs and symptoms of fibromyalgia. Pain in your neck, shoulders, back, and hips. Fatigue that makes it difficult to work or perform daily tasks. Difficulty sleeping at night. Restless leg syndrome. Migraines. Sensitivity to light, noise, or touch. Depression. Anxiety. Decreased libido. What are the risk factors for fibromyalgia? Fibromyalgia is a chronic disorder that affects the muscles and connective tissues. The cause of fibromyalgia is unknown, but there are many risk factors that may increase your chances of developing this condition. Some of the most common risk factors include genetics, hormonal changes, physical or emotional stress, and injuries or illnesses. The role of genetics. Genetics may play a role to have fibromyalgia. A recent study found that siblings of people with fibromyalgia were more likely to develop the disorder than siblings of people without fibromyalgia. This suggests that there may be a genetic component to fibromyalgia. Hormonal changes can cause fibromyalgia. The National Fibromyalgia Association, NFA, reports that hormonal changes may be one of the causes of fibromyalgia. The pain and fatigue can be so severe that they interfere with a person's ability to work, sleep, and participate in everyday activities. Physical or emotional stress is a risk factor. Physical or emotional stress can be a risk factor for developing fibromyalgia. It is not clear what causes fibromyalgia, but it is believed that physical or emotional stress may play a role. Stress can trigger the release of chemicals in the brain that can lead to pain and inflammation. It can also disrupt sleep and cause fatigue. Injuries or illnesses can cause fibromyalgia. It is believed to be caused by a combination of genetics and environmental factors. Fibromyalgia can be triggered by injuries or illnesses, such as carpal tunnel syndrome, rheumatoid arthritis, and lupus. Research has shown that people who have had surgery are more likely to develop fibromyalgia. How is fibromyalgia diagnosed? The diagnosis of fibromyalgia can be difficult because there are no specific tests that can confirm the diagnosis. A physician will typically take a medical history and perform a physical examination to look for characteristic symptoms of fibromyalgia. There are no lab tests or examinations that can be done to diagnose fibromyalgia. There is no test that can tell whether someone has fibromyalgia or not. However, doctors can look at the patient's medical history to see if he or she fits the typical case of fibromyalgia. You should try to keep a record of any symptoms that you have had, and any times when you are experiencing them. In addition, it is very important to be honest about your symptoms. Sometimes people may not report them. You should also document any medications that you are taking. If you think that your doctor is going to be suspicious of you because you don't tell him or her all of the symptoms, you should keep a diary or write down all of your symptoms in your own words. The doctor will ask about your symptoms, medical history, and physical exam. A doctor will do an X-ray or CT scan of your spine and take a blood test to determine if you have any infections. The doctor will then give you a list of possible causes of your symptoms. He or she will make a diagnosis based on the medical history and your symptoms. Your doctor may order special tests, such as nerve conduction studies if the medical history does not give enough information to make a diagnosis. How is fibromyalgia treated? Unfortunately, there is no cure for fibromyalgia, but it can be treated with medication and therapy. Some common treatments for fibromyalgia include pain medications, antidepressants, and exercise. Pain medications. The most common pain medications used to treat fibromyalgia are antidepressants, such as amitriptyline, Elavil, and nortriptyline, Pamelor. Some people find that these medications relieve their symptoms of fibromyalgia. However, others find that the medications do not help at all. The medications do have side effects, such as nausea, fatigue, and insomnia. If you are taking pain medications for fibromyalgia, make sure to talk to your doctor about any side effects you may experience. Antidepressants. The most common antidepressants used to treat fibromyalgia are tricyclics. Examples of tricyclics include amitriptyline, Elavil, clomipramine, anafranil, and doxepin, Silanor. These medications have been shown to provide some relief of symptoms in a small number of people with fibromyalgia. Due to the side effects associated with tricyclics, they are not considered the first line of treatment for fibromyalgia. Side effects can include dry mouth, blurred vision, constipation, sexual dysfunction, and weight gain. In addition to tricyclics, the antidepressant mirtazapine, Remeron, has been shown to relieve pain in some people with fibromyalgia. Exercise. Many people with fibromyalgia feel that exercise is one of the most important treatments they can try. Exercise is a key component of fibromyalgia treatment and has many health benefits. It improves physical fitness, decreases pain, improves sleep quality, and helps to decrease depression. It is important to note that exercise should be tailored to the individual, as some people with fibromyalgia are unable to perform certain exercises. What are the complications of fibromyalgia? Fibromyalgia is a chronic medical condition that causes widespread pain and stiffness in the muscles and joints. The pain and stiffness can be so severe that they can make it difficult to complete everyday tasks. Fibromyalgia also often causes fatigue, memory problems, and mood swings. While the cause of fibromyalgia is unknown, there are several possible complications associated with the condition. These include depression, anxiety, sleep disorders, and chronic pain. The symptoms of fibromyalgia can be so severe that they can interfere with daily activities such as sleeping, working, and eating. The condition also often causes chronic pain throughout the body in several different areas. This pain may occur in much more than one location. The pain of fibromyalgia may also be triggered by certain foods, medications, and chemicals. Most people who have fibromyalgia have some sort of triggers, such as stress or an illness. It also causes changes in the way the brain processes pain signals. In fibromyalgia, the brain becomes desensitized to the pain. When this happens, pain is felt in areas where it has never been felt before. It usually starts when a person is in his or her late 30s or 40s. It usually lasts for at least 6 months. It can cause symptoms throughout the body. However, most symptoms occur in the muscles and joints. Fibromyalgia medication. There is no one-size-fits-all treatment for fibromyalgia, but medications can help lessen the symptoms. Some of the most common medications used to treat fibromyalgia are painkillers, antidepressants, and anti-seizure drugs. Many people find relief from these medications and take them for a long time. However, with such chronic pain, it is important to be aware that some medications can cause side effects. Painkillers are the most commonly prescribed medications for fibromyalgia. Most painkillers work by blocking chemicals that cause pain signals in the body. Painkillers also cause the body to release endorphins, which are chemicals that act as natural painkillers. While painkillers can be effective in treating it, they can also cause unwanted side effects. The most common side effects of painkillers are dizziness, drowsiness, and dry mouth. Painkillers can also cause constipation or stomach upset. Antidepressants are also used to treat fibromyalgia. In addition to relieving pain, Antidepressants can help with depression and anxiety associated with fibromyalgia. Antidepressants can also cause side effects such as dry mouth, dizziness, and drowsiness. In severe cases, surgery can be used to relieve pain and correct muscle abnormalities. However, most surgeons do not recommend surgery for fibromyalgia as it is difficult to perform and has a high rate of complications. Anti-seizure drugs such as gabapentin and pregabalin are also used to treat fibromyalgia. These drugs help with pain, fatigue, sleep disorders, and pain sensitivity. While these drugs are effective in reducing pain and improving functioning, they do not work as well as antidepressants. Side effects include dizziness, drowsiness, and dry mouth. Gabapentin can also cause seizures in some people. Natural remedies for fibromyalgia. There are a number of natural remedies that can help lessen the symptoms. Some of the most effective natural remedies for fibromyalgia include exercise, diet modifications, supplements, various stress management techniques, and sometimes hypnosis. Exercise. Exercise is a proven effective way to manage the symptoms of fibromyalgia. A study in 2006 found that exercise decreases pain and improves function in people with fibromyalgia. Exercise is also known to decrease depression and anxiety and improve sleep quality. The National Fibromyalgia Association, NFA, has developed a self-management program for fibromyalgia called Fibromyalgia Self-Management. The NFA's Fibromyalgia Self-Management Program is a common resource for fibromyalgia patients and their physicians. Diet modifications. Diet modifications are commonly used for fibromyalgia. Nutrition is an important aspect of fibromyalgia treatment. There are two main types of nutrition that are typically recommended for fibromyalgia patients: whole foods and special diets. Whole foods are those that have not been processed, refined, or altered. Whole foods tend to be nutrient-dense, which is a term used to describe the number of nutrients in food. Supplements. Supplements are also a form of nutrition that is recommended for fibromyalgia patients. Supplements are used to prevent or treat deficiencies in the body's nutrients. Fibromyalgia patients are recommended to take a multivitamin, omega-3 fatty acids, magnesium, and B vitamins. Other forms of nutrition, such as hydrotherapy, are also commonly recommended for fibromyalgia patients. However, research has shown mixed results in the effectiveness of hydromassage for fibromyalgia. Stress management techniques. Stress management techniques, such as meditation or yoga, are also commonly recommended for fibromyalgia patients. Research has shown that compared to pain patients who do not practice mindfulness techniques, those who do practice it have a lower response to pain and report less anxiety. Mindfulness also reduces pain sensitivity and improves sleep quality. Several mindfulness-based stress reduction programs are available, including mindfulness-based stress reduction, MBSR, and mindfulness-based cognitive therapy, MBCT. Hypnosis. Hypnosis is another commonly recommended treatment for fibromyalgia. It has been shown to be an effective treatment for chronic pain and fibromyalgia and is often used in conjunction with other treatments such as cognitive behavioral therapy, CBT. Hypnosis has been shown to be a very effective treatment for migraine, helping to treat migraine and other types of pain. Living with fibromyalgia. Living with fibromyalgia is not easy. There's no one right way to cope with fibromyalgia. Different people with fibromyalgia may have different ways of dealing with the condition. For example, some people manage to cope by using humor and finding joy in their lives. Some people cope by avoiding pain and focusing on physical activity and hobbies. Others focus on reducing stress. While there is no one right way to cope with fibromyalgia, you may find some of these tips helpful. Coping with fibromyalgia can be difficult. People who have fibromyalgia are often very sensitive to stress. Some people find that continuing to live their lives, as usual, is the best way to cope. If you're able to live your life normally, you may notice that your symptoms are less severe. If you find that coping with fibromyalgia is extremely difficult, there are many other ways to help manage the condition. It is not unusual for people who have fibromyalgia to experience other symptoms, such as fatigue. If you're tired all the time, try to find things that make you feel better. For example, you might enjoy spending time with friends or family. You might also benefit from following a healthy diet and exercising regularly. In conclusion, fibromyalgia is an incredibly complex disorder, with no single cause or cure. It's also known as fibromyalgia syndrome, FMS. FMS symptoms can include fatigue, sleep problems, chronic pain, headache, and anxiety. Other symptoms that may be associated with fibromyalgia include stiffness, soreness, muscle weakness, and numbness. The causes of FMS are still unknown, but researchers have determined that there are several contributing factors that can increase the chances of getting fibromyalgia. Some of these factors include stress, physical injury, or trauma.